Hi, everyone, and welcome to This is Growing Old, the podcast all about the common human experience of aging. My name is Ashley Leonard, and I am the Development Project Coordinator here at the Alliance for Aging Research. A major part of my job is overseeing the Alliance's Talk Nerdy to Me program. Nerdy stands for Nurturing Engagement in Research and Development with You. So the Alliance for Aging Research's Talk Nerdy to Me network empowers older adults and their family caregivers to collaborate with clinicians and researchers on patient-centered outcomes research. Currently, we are seeking patients, family caregivers, researchers, and clinicians to participate in the 2021 Research Advocacy Training Program designed to empower senior patients and their family caregivers. Beginning in early December, participants will meet 3 times a week for 2 weeks from 12 to 1:30 p.m. Eastern Time to learn about researchers in their field and each other. Research advocacy training empowers patients and family caregivers. This research will help prepare advocates to serve as merit reviewers for organizations like the Patient-Centered Outcomes Research Institute or the National Institute of Health, sit on research-related committees such as institutional review boards, and partner with researchers in designing, implementing, or disseminating research. We also hope that participants bring the training back to their own communities and use it in their own personal care. But don't just take it from me. Here to talk about her experience with Talk Nerdy to Me is Ms. Teresa Wright-Johnson, who participated in 2019. Teresa, thank you so much for joining us today.
Hi, Ashley. Thank you so much for having me.
That's great. So, Teresa, why did you decide to become a patient advocate, and what does patient advocacy mean to you?
So, my journey with patient advocacy, as I think about this question, when I decided or how I decided, I think that this path and this journey was already before me. A little bit about my story is I was born with congenital heart disease. So I've been on this patient journey for my entire life. And what I realize now is growing up, my parents were my advocates. And I just distinctly recall a moment between my mother and I where she said to me, you know, you're growing up, you're going to become an adult, and one day you're going to have to advocate for yourself. You're going to have to speak up for yourself. It's your responsibility. So, as I look back to when I actively began engaging, it just made complete sense, and it became crystal clear to me in that moment that I had been being prepared for this path for most of my life. I think the only difference is now, in addition to advocating for myself, I'm empowered and I now advocate for others because I understand that we're all connected. So, it's like when you have that knowledge and you have that passion, you not only want to change the trajectory of life for yourself, but you want to do it for others. And I think that is the defining moment for me. And what does advocacy mean to me? Advocacy means to me that I not move forward in my patient journey alone, that as I move forward, I bring someone else along. None of us are on this path alone, and we're all here by design. So advocacy for me means standing for patients and patient autonomy. It means being a pillar in my community. It means speaking for the unspoken, and it means standing in a gap or helping someone else find their voice. It's just to me part of the human experience.
Absolutely, and that's very powerful. I agree. I think advocacy, it's important to be inclusive and bring someone along. That was really well said.
Thank you.
And to jump off of that, can you please tell us why you initially decided to apply to participate in the Alliance's Talk Nerdy to Me program?
Absolutely. So I was given the opportunity to participate on an advisory board for Heart Valve Voice a few years ago. And from there, I met Susan Peshin. And we talked about this, and I was so interested in learning more. So through my Susan from Heart Valve Voice and our Susan from Aging in Alliance, I was invited to the training. And I have to say, it was very exciting. I didn't know what to expect. Again, I call myself, or I identify as being a seasoned patient. But every time I go to these different trainings and these different conferences, there's always something else to learn. And that's actually how I got invited to Aging and Alliance Research to talk nerdy to me.
Wonderful.
Yeah.
That's wonderful. That's wonderful. Listen, a good reference is so important.
Yes.
That is really great. What did you learn from participating in the training?
So much. So I'm going to share this, and it's humorous to some degree, but sometimes we think that we know so much, and as an advocate and as a speaker and as a writer, sometimes I'm like, okay, well, I kind of know this and I know that, and am I really going to learn? How much more am I going to learn? And every time I'm super amazed. And every experience is humbling. So, I mean, when I got to the training, I knew about clinical trials, but we got so involved in what goes on in clinical trials and the technicalities and how to find a clinical trial, that, emboldened me, and that expanded my knowledge of clinical trials. The different organizations that were present, that I was allowed to, or that I had the opportunity to interact with and learn more about, that was crucial. And just the people who were there, from the different intersectionalities of illness and caregivers, that was amazing. Because here's the bottom line. When you go to these different trainings and conferences, you meet other people, and you realize that even though your journey may be different, it's all about the human experience. So we come with different experiences, we come with different backgrounds, we come with different illnesses, we come with different situations, but we're all committed to a better quality of life, to learning more, to banding together to advocate. You find that common ground, which is, to me, the connectivity of humanity. So, I mean, the training, for me, the training was just, it was more than I could have expected. And it really did exceed my expectations.
That's amazing. That's amazing. That's our key takeaway that we want our participants to have. We want it to be something so unbelievably beneficial, and that's great. To piggyback from off of that, have you used anything that you learned in the training in your own health journey since then?
Absolutely. So I am pretty involved. I'm very involved. I'm on multiple advisory boards, and I had always been a really involved advocate and really involved patient. But what this knowledge did was, again, it expanded my vocabulary. I really advocate for diversity and inclusion in research for Black people and people of color. I really advocate hard for that because, as you know, we are underrepresented in numbers in clinical trials. And what I did is like by learning about clinical trials and PCORI and, just processing this information, it just emboldened me to even want to do more grassroots work and clinical trials and, the recruitment, for lack of a better word, of Black and brown populations and the underserved. So, a couple of my organizations, we are really committed to that. And I know I work on that front with more specifically with heart, but also with multiple sclerosis. That's one of my really passionate focuses for that.
That's great. That's great to hear. And why do you think others should participate in the training?
I think others should participate in the training because they would learn so much about the patient journey. They will hear about other experiences. They will learn about different organizations such as PCORI and the NIH. They will learn what they can do as a patient to empower them and to empower their communities and take it back to their communities. And, the icing on the cake is you get to meet so many different people from different spaces that you network with. And you never know what may come of that, what kind of collaboration may develop. You never know what you are going to learn and who you're going to meet and how that may impact your patient journey.
That is so true. That is so true. And again, well put. To shift focus, when you were a kid, what did you imagine growing older would be like?
Hmm. Actually, that's that's a tough question. I'm going to tell you why it's a tough question.
Mhm.
Uh, so when I was a little child,
Mhm.
I loved baby dolls, Barbie dolls, and things like that. So that part of me imagined growing older would be, a husband and children. And, I never looked past that. If you ask me this question as probably after I found out about, after I really realized that I had this lifelong condition that I had to live with of aortic heart disease, congenital heart disease, I think my expectations were different because, to be honest, we didn't know what growing old would look like for me. My parents didn't know what growing old would look like for me. So there was a time when I didn't even imagine that I would grow old. So I say that to say this: hope is so important. Research, clinical trials, advocacy, they all played a role. Great medical care, a great family, a great support system, they all played a role in my presence here and my opportunity to speak to you about these things. So, although for that point in time, I did not know what growing old looks like, and to be honest, I still don't really know because who knows? What I am emboldened by and what I have resigned myself to do is to live each day, to appreciate the moments, and to leave my footprints in the sand. And not only make this life about me, but make it about those who may come after me that, may have a diagnosis that they don't know about or that they don't, that they're afraid or someone's mother or father or husband or wife or care partner who doesn't really know about this life of the patient journey. I think that's what our lives are. I think that they are tutorials, and not for us, but for the community and the greater good. So that's what aging looks like for me.
That is amazing. That actually answered the next question about what you enjoy most about growing old now. And that's really powerful that you feel so emboldened and empowered by creating a space to where you're making, a path for the next person. That is so amazing. And you are definitely the type of story we like to have as far as our program and how it's beneficial to you. Teresa, thank you so much for joining us today on This is Growing Old. Before we wrap up, I want to encourage everyone to learn more about Talk Nerdy to Me at azingresearch.org/nerdy. The link will also be available in our show notes if you weren't able to catch that. We are looking for, as I mentioned before, patients, family caregivers, researchers, and clinicians that are involved in Alzheimer's disease, as you mentioned, heart valve disease, atrial fibrillation, chronic pains and disabilities, and macular degeneration in adults aging 65 and up. Our participants successfully completing the workshop will also receive a stipend of $1,500 and a certificate of completion for participating in the training. And we hope that you all are moved to apply. Ms. Johnson, I couldn't have said it any better myself. So thank you all for listening to This is Growing Old, and you'll have a great day.